The end of hair loss is closer than ever. In my opinion, GT20029 is undoubtedly, along with PP405, one of the most promising drugs in the fight against androgenic alopecia. And today we have important news about the drug that I'm personally most excited about, GT20029. The last time we spoke about this compound on the channel was over a year ago, but now we have confirmation of the validity of the phase 2 clinical trial data. Kinto has published the results of this study in a peer-reviewed medical journal. This new treatment is a PROTAC drug. PROTAC drugs work by protein degradation, positioning themselves as a future of treating various conditions, such as, for example, breast cancer. As I've explained countless times, androgenic alopecia is caused by two factors: the sensitivity of the follicles to DHT and the amount of DHT we have in the follicles. The most effective treatments currently available, finasteride and topical, aim to reduce the DHT levels in the scalp. The problem is that currently we don't have any drug that significantly reduces the sensitivity of the follicles to DHT, and that's where GT20029 comes in. Androgen receptors are proteins that bind to male hormones. GT20029 has been designed with the purpose of degrading these receptors and thereby effectively blocking their physiological function. These might sound familiar, like pyrrolidine or Finasteride, which are also androgen receptor antagonists. However, none of these drugs act like GT20029. A single molecule of this compound can destroy multiple androgen receptor proteins, unlike these other drugs where each molecule can only attack one receptor. In this case, the PROTAC is a dual-function molecule. One part binds to the androgen receptor and the other part binds to the cell's garbage collector system, called the E3 ligase. The E3 ligase marks the androgen receptor with a tag called ubiquitin, signaling it to be destroyed by the proteasome. The proteasome is a protein complex present in all cells whose main function is to degrade damaged, unnecessary, or old proteins into amino acids that the cell can reuse. The most revolutionary thing is that the original PROTAC is not destroyed, it is recycled to destroy more receptors. This means that a small dose of GT20029 can eliminate many androgen receptors, reducing the risk of systemic absorption and side effects. All this theory is great, but what does the science say about GT20029? First, let's recall the phase 1 clinical trials conducted in China and the US in 2022 and 2023. These studies, which analyzed over 200 patients, demonstrated that systemic absorption of the drug was virtually nil. After topical administration of multiple doses of GT20029, the average maximum drug concentrations were extremely low. This highlights one of the advantages of GT20029 being a topical PROTAC drug. Systemic exposure is minimal, and PROTAC drugs can be effective at low doses, which could significantly reduce the frequency of use compared to other medications. In short, in these initial studies, the tolerability was good, and no significant side effects were reported. Now let's look at the phase 2 study published just a few days ago. This case study was a phase 2 multicenter randomized double-blind placebo-controlled clinical trial that analyzed 180 men with androgenic alopecia. This study sought to find the optimal dose of GT20029, testing two concentrations, 0.5 and 1%, with two frequencies of use, once daily or twice weekly, for only 12 weeks. The results of this study are very encouraging. The GT20029 groups achieved a statistically significant therapeutic and clinical improvement compared to placebo. Specifically, the regimen with the best absolute results in hair count was the group using 0.5% once daily, which achieved an increase of 16.8 terminal hairs per centimeter square, resulting in 6.7 more hairs per centimeter square than the corresponding placebo group. Furthermore, the 1% twice weekly dose was also significantly superior to placebo, with 7.37 more hairs per centimeter square than the placebo group, and was the only dose to demonstrate a significant improvement in hair thickness. We're talking about GT20029 proven to be significantly more effective than placebo in less than 3 months. The fact that these results are seen in such a short period of time and with such small groups of people, about 30 men per group, is very promising. Regarding safety, the drug demonstrated excellent tolerability. The only side effects caused by the drug were itching and dermatitis. Moreover, the reported side effects were comparable to the placebo group, and hormonal analysis confirmed the serum testosterone levels remained normal across all groups. And most importantly, no sexual side effects were reported. Thanks to this efficacy and frequency data, the 1% twice weekly dose was chosen by Gintar to be analyzed in the large phase 3 clinical trial. The results of this phase 2 study have enabled Gintar to select the dose. The 1% twice weekly concentration is the optimal concentration that will be studied in the next phase 3 clinical trial in China. That study has likely already finished, so it wouldn't be a surprise if Gintar releases a new press release with the results of this study in the first months of 2026. It is true that PROTAC's phase 3 results were discouraging, but this new GT20029 study renews hope for a drug that can compete head-to-head with Finasteride and Finasteride in terms of efficacy for treating hair loss. However, due to its mechanism of action, GT20029 might not be a rival to Finasteride and Finasteride, but rather their best friend. In theory, combining Finasteride or Finasteride with GT20029 should yield a synergistic effect, since they attack different factors of androgenic alopecia. Combining both treatments would attack the two main factors. GT20029 would reduce the sensitivity of our follicles to DHT, while Finasteride or Finasteride would reduce the amount of DHT reaching the follicles. While we now talk about the famous big three for hair loss, Finasteride, Minoxidil, and ketoconazole, the paradigm could shift, and we must start talking about the big two formed by Finasteride and GT20029. Speaking of which, if you're afraid to use Finasteride or Finasteride because of possible side effects, I've just published the most comprehensive book on this topic that will answer any questions you may have and help you make an informed decision. I'll leave the link in the description. You should know that GT20029 is the first topical PROTAC drug that have completed phase 1 and phase 2 studies both in China and the US, and the first clinical trial to demonstrate the therapeutic benefits of a topical PROTAC drug. Now all that remains is to wait, but we're daily getting closer to finding the cure for hair loss. And who knows, perhaps the combination of Finasteride or Finasteride with GT20029 will be the definitive solution. Although other treatments will surely hit the market sooner, like Bizula, which by the way we need to talk about next week because there's some very controversial updates. Personally, I remain much more optimistic about GT20029 in terms of efficacy. Without that, PROTAC technology can mark a before and after, a true paradigm shift in the treatment of many conditions, including androgenic alopecia. And if you want to know more about what I consider to be the second most promising hair loss treatment, you have to watch this video.